I perform all manners of treatment and diagnosis for ear disease. That includes ear infections, hearing loss, dizziness, and skull-base tumors. Hearing loss usually happens slowly over time, so many patients are often very surprised at how much hearing loss they actually have. In problems in the middle ear, we're often able to reconstruct the small hearing bones that conduct sound to the inner ear and rebuild the eardrum. In cases where the inner ear is damaged, we can place a cochlear implant into the inner ear. This is an electronic device that actually reconstructs hearing and allows signals to go from the device to the brain directly to restore hearing to someone who's deaf. There's nothing better than seeing a patient after treatment that can hear again. When you turn that cochlear implant on after the surgery and their faces just light up with joy when they can hear again, is just a wonderful thing.